hello to our viewers.
Welcome to Alagang Alaga, the digital health show of Alaga Health.
Ortega, and here with me is our resident doctor, Dr. Dexter Galban. And I'm very excited because this is our first ever episode and we will be talking about an important health matter for every Filipino.
We are all currently feeling the effects of the pandemic, which has brought a lot of uncertainty about what the future holds. This has caused Filipinos to experience more stress and strong emotions that are affecting their mental well-being.
And while this COVID-19 is happening, another pandemic is right around the corner. This is all because of the pent-up stress and anxiety that we are all experiencing. And because of this, our first ever topic will be all about the whats, the whys, and the hows of mental health.
And that is why today we are very excited to have with us amazing speakers and mental health advocates who are here to share about how we can better take care of our mental health. So first up, we have Dr. Raymond John R.J. Naguit, who is currently the chairperson of Youth for Mental Health Coalition, chairperson of Akbayan Youth, and a college instructor from the Far Eastern University.
And our next speaker, Dr. Gia Sison, the co-founder of #HealthXPH, Philippine leader for Livestrong Foundation, and she's the founder of Padayon.
Alright, so hi everyone. Thank you for joining us today. Thank you for being part of this webinar. And hopefully we can have a very engaging discussion when it comes to talking about mental health. Alright, so first up, I think this is very essential for everyone to know because first and foremost, we have to answer the question, what is mental health and what is mental health illness? Because according to the World Health Organization, mental health is the state of well-being in which every individual realizes his or her own potential and can cope with the normal stresses of life, can work productively and fruitfully, and is able to make contributions to his and her community. Now, that is the World Health Organization definition. I would like to know if you have your own personal definition on what mental health is and what mental health illness can be. So probably we could start with Dr. Gia Sison.
Hi, and thanks for inviting me to Alaga. Yes, I agree with the World Health Organization. The definition is that way. Pero siguro we'll look at illness in another parang side of it. It can happen, but I think it's about time that we talk about it as it's a state of wellness too. So I would, of course, yan yung definition.
Let's move on to RJ. As a long-time advocate of mental health, as a registered nurse, and as a physician, do you have your own personal definition, probably a simpler version of what mental health is or what mental health illnesses can be?
Okay, first of all, I recognize that the World Health Organization definition is very comprehensive already. But for me, when you ask me about my personal definition, I would always relate mental health to really recognizing our humanity. Because as humans, we feel a full range of emotions, diba? Happiness, sadness, anger, frustration, all of those things. But of course, when we talk about mental health, it's always about the congruence of your feelings to the external environment that you're in. So, syempre, pag nagkaroon ng incongruence doon sa internal mental health state mo and the environment, then usually that's my definition of mental illness. And again, I'd like to emphasize, as individuals, our ability to is all an indicator of mental well-being. Kasi at this point in time, we have to recognize that there might be a lot of abnormal situations happening to us. And as long as we can cope and continue to find meaning in what we do, we can be considered mentally well.
Alright, and now we will turn our attention to our very special guest, Miss Philippines Earth Water 2020, Miss Gianna Llanes.
Before anything, Good evening. I thank you so much for inviting me to this discussion because I really believe that this is something, taking care of yourself both physically and mentally is something that is undermined, especially dito sa Pilipinas. But we have to discuss amidst this pandemic. So thank you for having me here and for including me in this prestigious panel. I mean, how cool that you're all doctors and all experts in the field. So I'll try to contribute as much as I can with my own experience with mental health and my mom being a psychologist herself as well.
To you, what is your definition of mental health?
Whoa, parang pageant lang
Exactly. I know, you're
Madami yan,
trained,
babe.
you're trained for this, right? The succinct answers about critical issues, you were made for this. So, what is your personal definition of mental health?
I think my personal definition of mental health is just, the state that your emotions are in. I know that is a little bit risky to say, but based on my experience about mental health and seeing a therapist myself before, it's really emotion driven and figuring out where these emotions are coming from and how to address them. And I think that's my basic definition, but I honestly think that the discussions about mental health, lalo na dito sa Pilipinas, are lacking so much. Unfortunately, there is still a stigma against it, and I can just elaborate on that today with your questions. I hope that answered your question.
Thank you very much for your personal definitions on mental health and what possible mental health illness can be. So perhaps for the next question, we can go to Justine.
So our next question about it actually is, what are the most common mental health conditions or illnesses, and who do they affect the most? Like, do they affect a certain gender or do they affect a certain age group?
For me, from a personal standpoint, it can actually hit anyone. Although may statistics naman yung WHO, I think RG 2016 yun, di ba? They last released that 3.2 million actually suffer from depression, and close to that number also yung anxiety naman. And then more females than males. That's also one findings of the study. So, yun, statistics-wise, I think that answers your question, Justine.
For RG, any thoughts? Based on your experiences as the leader of Youth for Mental Health Coalition, and I know that you have been conducting a lot of kumustahan sessions and learning sessions also with different mental health advocates. What have you noted to be the most common mental health conditions, or at least what are the things that they usually go to you for, or what do they usually express in these particular sessions?
Well, the usual mental health conditions that we encounter, especially for young people, are related to mood disorders. So this includes depression, anxiety, bipolar disorders. And usually, these are actually things that we can encounter also in the workplace. So definitely, each person or each sector has its own risk in terms of mental health.
Let's take depression. Let's pull that out because that's very common. Ano yan? It's chronic sadness, like for 2 weeks, more than 2 weeks. Even your whole your insight is affected, your mood, hindi ka makatulog or tulog ng tulog. It's extremes nawawala ka ng appetite, kain ka ng kain. There are usually ganun yung takbo in terms of depression. That's why we cannot totally invalidate kasi people who say that they feel parang depressed, because that can actually be the start of an ongoing diagnosis. So personally, and RJ also, we have been encountering a lot of that, especially when faced with uncertainty. Ang daming nawala, we like lost opportunities, change in a lot of habits, how our lives are gonna be. It's really a total parang 360 adjustment that we all make. And with that, adjustments are never easy. So, that, tapos if a-factor in mo pa yung, loss of job, delayed dreams, it can actually be a huge trigger for possible mental health illness.
Doc, in line with that, you've mentioned na it starts from sadness and then continues 2 weeks, nagiging depression siya. Ano yung parang nagiging change or trigger point before nagiging clinical depression talaga yung sadness that you experienced?
It can actually be an event, or pwede rin siya kasi maging
Drastic.
physical, or pwedeng chemical imbalance rin kasi siya. Although kami kasi we're not really into meds agad. As much as possible, we take it in terms of, so to speak, in psychotherapy way. Meds will be the last resort. But we cannot really take off the chemical imbalance part in depression. But that doesn't mean that hindi siya curable. Kasi there's always this notion that if you are under medications, it's never gonna be okay or for you. And there's a stigma pa rin din that we have to bust in terms of taking medications because of a condition. So it's really a balance of everything. Biological, memorize ko na yung slides. Biological, there's a mental part, and of course, there's a social component. Hindi mo maaalis yung environment. That's why whenever we encounter individuals who are expressing their feelings, parang we're really constantly assuring them that they have a community to run to. They can actually open up to people na parang they can trust, na hindi sila i-judge, na hindi rin sila i-invalidate in terms of their feelings.
Yeah. For me naman siguro, when we talk about negative emotions, they do not always equate to mental health conditions. No? So hindi automatic na malungkot ka, meron ka ng depression. So a lot of factors come into play there. And sabi nga ni Doc Gia kanina, we have what we call the Biopsychosocial model of health. So the biological as well as the psychological aspects of a person can lay down the vulnerabilities. Pero usually, yung mga nagiging trigger dyan are social factors. No? So conflicts, problems that a person encounters, an adverse life event. No? For example, nag-break sila ng boyfriend or girlfriend ng person or namatayan sila. Then those can be trigger factors also.
Have you ever experienced any mental health concerns? And if ever you did, what are the signs and symptoms? So this is my question for Gianna. Have you ever experienced mental health concerns? And if ever, what are the signs and symptoms that you experience?
Well, I can go on about this for hours. Because I was actually diagnosed with major depressive disorder back in 2015. And I remember it first started happening when I just wasn't motivated to go to school. I started working at the age of 18 and there was an abrupt stop, and that was beyond my control. So I felt like I just had no control of my life. Things were going downhill. And my mom was actually the first one that pointed out to me to go see a psychiatrist because she's a psychologist herself. She said that she's seen my face was just so tired. My general aura was different. The way I reacted to people and had conversations with other people was just not the same because I'm generally an optimistic, bubbly person. And at first, because I had already been working in the public eye at that time, sabi ko sa kanya na ayoko, I don't want to see a doctor. I don't think that people will still look up to me or will still see me in the same way if they find out that there's something wrong with my emotions, quote unquote. But at that time too, I actually wanted to stop going to school just because I had no motivation to go to class. And she said that the only reason that the only way that she would allow me to take an LOA from Ateneo is if I see a psychiatrist and I get diagnosed and I started taking medication. So that's exactly what had happened. So the first symptoms were, I think my mom saw them before me. It was just, it looked like life had been sucked out of my face. There was no color in my face. I wouldn't be able to sleep at night. I was just mad at everybody and I didn't know why. And I think that's a misconception that a lot of people have about mental health. You know, they think na yung unang tanong when you say that you're depressed, you have anxiety, that you're bipolar is bakit? Or saan nanggaling yan? And a lot of the times you don't know. So that's exactly what happened to me. And I'm so lucky that I had my mom and people who cared for me, my lola, who told me that it's okay to get help. And I'm lucky with them again because I know that dito sa Pilipinas, families are not that open to it. We're still a little bit conservative and traditional. And at that time too, my university didn't have that many cases of people openly talking about mental health. So I'm glad I had my lola and my mom.
I'm curious. There are some people in our environment that are unavoidable because we have relationships with them. It could be a friend, a family, or a colleague, and you really have to deal with them every day in our lives. So I'm wondering, how can we have a relationship with toxic people that will not affect our mental well-being?
Us kasi, well, I can only speak also for me and RJ kasi we're always together and we work sa Youth for Mental Health Coalition. I think it's also a matter of giving feedback. Ano kasi tayo we're scared of actual feedback kasi baka may marinig tayong hindi maganda. But the past few months have taught me a lot about getting feedback from others. Kasi baka rin naman kasi they're not aware of how they are acting. Dun papasok yung education. And for me, it's two ways. You cannot just call out someone and not like give a possible solutions, for lack of a better term, no? So parang dapat merong you have to strike a balance between trying to educate the other person and at the same time ikaw mismo you also don't feel that you're hindi ka binavalidate from a personal standpoint. So merong doon, there's a fine line between that, and I hope we get to that point that we're not scared of speaking up respectfully, hindi yung call out lang tapos wala na. I mean, kasi yan ang nangyayari sa social media. Call out and then stop. But there's this call out, but baka may reason yung isa. So we always talk about that, and that's a constant question also we get, how to actually tell the other person. So I think giving respectful feedback is possible, and there's always that DM button you can use. I mean, di ba may doon parang respeto pa rin for an individual. Baka rin like personally, you always have to come from a place that you also want to learn. Kasi not everything naman sa buhay, you know it. No? Sino ba nagsabi na? Later on someone quoted kasi na parang whenever you meet someone, they have an experience that you'll never know about.
Mm-hmm.
Si Bill Nye. Si Bill Nye. I-google ko na lang mamaya. But he really said that, and sabi ko, nga no, parang every person I meet brings me to an experience or a belief that I may have never known of. So, I think we always have to come from a place na ganyan. Just so, parang we keep going and really learn dynamically.
Ako kasi, hindi ako fond sa labels. I mean, wait, parang mali yun. Pero, when you label someone as being toxic, no? Yung ibig sabihin ko. So when you label someone as being toxic, it doesn't really open up the conversation. So pag na-label mo na siya, wala nang way for you to actually communicate with them. So important talaga na natin, no? Na matignan natin yung person na someone na pwede pa nating i-influence. So I agree with Doc Gia completely when she said we need to educate people. And of course, nandiyan na rin yung pagbibigay ng feedback. So when we provide feedback, I think it's important for us to anchor on what are the objective things that we notice. So kung i-label natin yung isang person na yun as being toxic, instead of calling them as toxic individuals, baka ano kaya yung behavior na inaan nila, dinidisplay nila? Ano yung specific na ginagawa nila that we find toxic? Kasi yung toxic can be subjective, di ba?
Mm-hmm.
So, important talaga na ma-identify natin yung mga actionable points and then we anchor our feedback doon sa observable na yun so that they can actually refute it later on. Kasi pag umabot tayo dun sa very subjective conversations, that can be another source of conflict and it can block the potential sources of community or the potential opportunities for communication.
To watch the full version of this webinar, don't forget to sign up at portal.alagahealth.com.
In the Philippines, 8 out of 10 Filipinos have never had a medical checkup, while 6 out of 10 Filipinos pass away without ever seeing a health professional.
For a lot of Filipinos, it's hard to stay healthy and get better when you have to wait in long lines, pay expensive fees, and travel far for the services you need.
Today, we proudly bring you the Alaga Health App, the Philippines' all-in-one healthcare mobile and web application that helps you get health services anytime, anywhere, in every way.
The Alaga Health App offers a complete online medical suite for Filipinos. Teleconferencing allows you to consult from your phone or laptop anytime without going to a clinic. For your loved ones who can't leave the house, you can use the home visits function. You can also say goodbye to long waiting times at the hospital using the clinic visits feature. For emergency situations, you can use Doctor on Demand.
With Alaga Health, the future of healthcare is now at your fingertips. Quality healthcare, anytime, anywhere, in every way.
Be updated with the latest on health and wellness by following us on our Facebook page, Alaga Health, and joining our Facebook community, the Alaga Health Community. You can also follow us on Instagram at Alaga Health.